folks. I guess this is more just for Dr. Verhoff, but we are going to be doing some palpation assessment of this lovely patient's knee today. So first thing that we're going to do is we're going to bend him up to about 90 degrees of flexion. This is going to allow us to palpate around a little bit. If the patient was unable to get to 90, we would just palpate in whatever available flexion we had. So we're going to start down and we're going to go into the inferior pole of the patella. So we're feeling around for that. And then as we go a little bit more inferior, we're feeling around, and that's the patellar tendon. If you keep on going down a little bit more, I can feel the tibial tuberosity. And then I'm going to be feeling medial, so I'm feeling for kind of that medial joint line. So I'm coming medial a little bit, and then as I come even more medial, I will feel the MCL. So then I want to rub perpendicular to that and feel for that. Can you feel that I'm on your MCL?
Mm-hmm.
Alrighty. And then we're going to come back across, still on that joint line, and we'll feel the lateral joint line. So you feel that, and there's a little bit of a divot there. So keep on going. If you go even more lateral, we're on our LCL. So with this, we're still palpating, and we're going perpendicular to the LCL. And then there's also the lateral epicondyle, which is up here. So this is on the femur, lateral epicondyle. Medial epicondyle is up here. As we keep on going more proximal, so if we're going lateral, we keep on following it. We can feel the IT band. So is that painful at all, patient?
Yeah.
Okay. So then we're in the IT band. Lastly, for palpation, if we go 2 inches inferior to the joint line and then medial a little bit, we can feel the pes anserine. So that's in there, and that's where the sartorius inserts along with the sembitendinosus and gracilis. Next, we're going to be doing passive range of motion with this patient. So with this, we're just taking her through, and we're seeing what her available range is. So we're also feeling for end feels. It's going to be a soft end feel, or it's soft tissue approximation. And then when we come out into extension, it would be a bony end feel as the femur and the tibia are approximating to. So we're feeling around for that and making sure that it's not an empty end feel when we come there. Next, we're going to be doing some active range of motion. So I would ask the patient to flex their knee up for me, so as far as you can go. And I will assess using the goniometer. So we're going proximally to the greater trochanter, and then distally to the lateral malleolus. And then this is going on the epicondyle, I believe. Is that correct?
Yes, that's right.
Thank you. And then, so feeling down, then to the malleolus. So she is actually at 142 degrees of flexion, so a little bit more than what I had. And then we'll also go into extension. So can you actively extend your leg all the way out? Good. So again, the bony landmarks remain the same. And when doing so, it's a little bit difficult on this bed, but we're about 0 degrees of extension, which is normal. Along with that, there's also joint mobility at the tibiofemoral joint. So this, we're flexing them up to 90, and then we're stabilizing proximally on the femur, and then we're moving distally at the tibia. So with this, you want good total contact, so you want to be a little bit below the joint line, so we don't want to be using the webbing, we want to be using our palm. And then what we're doing is we're applying a anterior posterior pressure to the patient, and then we're assessing for hypomobility, hypermobility, or it's normal. And then you can also turn this into a MOB. The other thing you can do is you can do a patellofemoral joint mobility assessment. So what we're doing is we're extending the patient's leg and then assessing for movement of the patella. So assessing hers, she does move a little bit. I'd say she may have a little bit of hypomobility with lateral deviation. And then as we go superior and inferior, this one's a little bit more difficult to do. I'm not able to really move her as much. so maybe a hypomobility. But further assessment is to follow. Last one is some manual muscle tests. So if you could come on over to the edge of the bed. So we would be assessing both legs, but first I'm just going to do this leg. So L2, which is hip flexion. So can you raise your leg up for me? Good, and hold. Good. Next is L3, which is knee extension. Can you press into my hand and hold? Good. We'd also want to assess some of those knee flexors too. So can you pull me in? Good. So she's very strong. And then can you bring your foot up for me? So this is dorsiflexion, which would be L4. Good. And then L5 is great toe flexion. Good, and hold. And then the last one is S1, so this would be plantar flexion. So press down and then don't let me pull up. Good. And then I would also assess the other side. And that concludes this video.